Sorry.
There's coming off of there. See this thing right here? Let me just cut that out of the way. It's in my way. All right, now right here, this is coming from the testicle, right, which is right there. All right, now the only thing I wanted to really show you, right here, coming up this way from that testicle is what's called the spermatic cord, C-O-R-D. And the spermatic cord has a vas deferens, an artery, and a vein, and of course nerves. All right, that's in the cord. All right, now, up here, let's just kind of get that, that's not part of it. There's it. You come on up this way. Now, if you look right here, this is actually, you can't really see, that would go on back to the aorta. But the main thing here, the main thing that I normally many times ask.
Can I push this a little bit?
You can do whatever you need to do.
Do
whatever you need to do. All right, now look. Here's what you need to be aware of. That little line, that little tube coming around right there is the vas deferens. Okay? It will join up with one from the other side. There's the urinary bladder. But what these things do is they actually join and go through the prostate gland. Go through the prostate where that as they get in there, that will become the urethra and go to the outside. But normally all I really ever ask on this is the vas deferens, possibly the spermatic cord right here. That's typically all. Of course, you would know the testicle down there, obviously. All right, so I think you can handle that. So on the male reproductive, and normally we have, I like to have at least, 4 or 5 male cats. Was this the only male cat that was in here?
Yeah.
Y'all don't remember? Was it the only one? Yeah, okay, this was the only one. And that was yours, Michelle. So, so let's go and make sure you know that is just fat. Both fat pouches associated with the urinary bladder. So, and we'll talk about this when we do reproduction in class. But in other words, this is the nerve supply, the blood supply to the area, and then the reproductive structure. And we'll talk about all that in class. But coming out here in the spermatic cord will be. And I typically ask possibly the spermatic cord and the vas deferens, and right here the testicle would be, it's got the skin off of it now, right there. And I would there it is right there. There's one right there. Yeah, that's what I say.
Can we just put testes just for that?
Yeah, yes, ma'am. Sure.
Testicles, we can say testes.
Can you go through it one more time?
All right, there's a testicle right there. Here is a spermatic cord, and the spermatic cord has an artery, a vein, the vas deferens, and also a nerve supply. And it comes coming this way. You see, the vein, the artery is coming this way. It's all in there. It's just a tiny thing. It's bringing blood to, the vein is carrying blood away from, and then the vas deferens is carrying the seminal fluid this way, and it will join with the other vas deferens, and that will go through the what's called the prostatic urethra. There's 3 phases to the urethra. There's the prostatic urethra, the membranous urethra, and the penile urethra. But we don't dissect all that stuff. But this just kind of gives you an idea of that. And see, a vasectomy in a human, the vasectomy involves cutting and tying off the vas deferens. And, of course, that obviously will interfere with, sperm getting to the outside. All right, but anyway, everybody, there is that part right there.